Many men believe that Tadalafil simply helps with erections when needed. It feels straightforward, especially when symptoms first appear. What is less known is that the body may already be compensating in other ways long before any clear problem is noticed. That's why many men don't realize this medication may be influencing their body in ways they never expected. Hello, I'm Dr. Ananya Rao. I work with men's health and urology, and here on this channel I explain medical topics in a clear and practical way, so you can better understand your own body and health. In this video, I'll help you understand how Tadalafil actually works in the male body, what it's commonly used for, and some physiological effects and limitations that many men aren't aware of, especially beyond erections. To understand how Tadalafil works, it helps to first understand how blood flow is regulated in the body. Normally, blood vessels respond to chemical signals that tell them when to relax and when to constrict. One important part of this process involves an enzyme called phosphodiesterase type 5, or PD5, which breaks down a molecule that helps blood vessels stay relaxed. As men age, or with certain lifestyle factors such as stress, smoking, or metabolic changes, this system can become less efficient. Blood vessels may not relax as easily, and circulation to certain areas of the body may gradually decrease. At first, the body often compensates quietly. These early adaptations usually go unnoticed, which is why many men don't realize there has been a gradual shift until symptoms become more obvious. By the time something feels different, the process has often been developing for months or even years. Tadalafil works by blocking the PD5 enzyme, allowing blood vessels to remain relaxed for longer periods. Most men are familiar with how this helps with erections, but what is less commonly understood is that PD5 is also present in other areas of the body, including the lungs, the heart, and the prostate. Because of this, Tadalafil may influence circulation beyond the genital area. Some men notice subtle effects, such as slightly improved circulation or better physical tolerance during daily activities. These effects are usually mild, and the body gradually adapts to this sustained relaxation of blood vessels. That adaptation is one reason why many men don't consciously notice these broader changes unless they are specifically paying attention to them. Over time, the medication can shift how blood vessels respond, which may explain why some men report a general sense of improved stamina without directly connecting it to Tadalafil. Another effect that often goes unnoticed involves spontaneous morning erections. These erections are commonly associated with healthy circulation and normal sleep-related hormonal patterns. Tadalafil can help restore some of this spontaneous activity by supporting blood flow during sleep cycles. What many men don't realize is that morning erections serve a physiological purpose. They help deliver oxygen-rich blood to penile tissue, which supports long-term tissue health. When this process is reduced or interrupted, changes can occur quietly over months or years without causing immediate concern. Tadalafil may help restore this pattern, but it does so as a supportive or compensatory mechanism rather than correcting the underlying reason why the body stopped producing these erections as frequently. Because of this, some men interpret the return of morning erections as a sign that everything has returned to normal. In reality, the medication is often supporting a function that the body is no longer maintaining as efficiently on its own. There can also be a subtle psychological shift with regular Tadalafil use. For many men, the medication reduces performance anxiety, which can create a more relaxed and confident state during intimacy. This is often helpful, but over time it can lead to a mental reliance on knowing the medication is present. Sexual arousal involves both physical and psychological signals. When Tadalafil becomes the main factor ensuring reliable erections, the brain may begin to associate confidence primarily with the medication rather than with the body's natural response. As a result, it can become harder to tell whether natural erectile function is improving, remaining stable, or gradually changing. Many men only become aware of this shift when they miss a dose or consider stopping the Medication. Another important effect that often goes unnoticed involves the prostate and urinary system. Tadalafil is also approved for treating benign prostatic hyperplasia, or BPH, which is an enlarged prostate that can affect urination. The medication helps relax smooth muscle in the prostate and bladder neck, which may improve urine flow and reduce urgency. Even when men take Tadalafil primarily for erectile support, they may be experiencing these urinary benefits without realizing it. Because these changes tend to occur gradually, symptoms such as waking up multiple times at night to urinate may quietly stabilize or improve. If the medication is stopped, urinary symptoms may return, sometimes suddenly, which can be confusing if the connection wasn't previously understood. This does not automatically mean that something is wrong. Tadalafil is a well-studied medication, and many men use it safely for long periods. In many cases, the changes described here can be managed with awareness and open communication with a healthcare provider. Understanding how your body responds is often the first step toward making informed decisions about your health. Every man's body is different. Symptoms and changes can have multiple causes. This video is intended for educational purposes and does not replace medical evaluation. If symptoms persist or raise concern, speaking with a qualified doctor is always the safest step. Now I'd like to ask you a question. Have you noticed gradual changes such as improved circulation, differences in morning erections, or shifts in urinary habits while using Tadalafil? If you feel comfortable, you can share your experience in the comments. If this video was helpful, consider subscribing to the channel. In the next video, I'll explain how testosterone levels can quietly influence the way Tadalafil works in the body. Understanding your body is an important part of taking care of your health.